Hello, here we are again, Luke and I, continuing with our videos related to the textbook Mosby's Fundamentals of Therapeutic Massage. And we are going to be looking at kind of a new segment, Luke. We're going to be talking about Chapter 10. If you want to go ahead and open that up to Chapter 10.
I'll get there.
There's 9. Draping
There's
we
10.
did. There
Yep.
we go. Okay. So this one is massage manipulations and techniques. This starts kind of the actual application of massage and understanding what we're doing. Before we can talk about the methods, we've got to talk about what we are trying to accomplish and when we apply a method, what happens. So that's this chart.
Right here. And I'm going to do a little zoom in for you guys. Let me just get this moved just a touch. Might not be perfect, but hopefully you can read that a touch better.
So this box is called Massage by the Numbers, and it really encompasses and embraces any method or modality or system just by understanding this and working with adaptations with it. So we start out with with an outcome. What is going to be the end result? And so there are 4 of those: relaxation and well-being, which is actually the foundation of everything we do. And it's got the most research too to support that. Then we move into stress management, which is more of a full body approach as well. And then pain management, which can be local or general, and functional mobility support. And when people come in for a massage, this is what they're saying: I want to relax, my shoulder aches, and I didn't sleep very good last night. So these 4 things, these 4 outcomes are ways that you can manipulate how you're going to choose the massage and create this unique massage for them. And back when we were talking about research, these 4 areas are able to be justified with evidence. So that's kind of cool too. Now, once we understand what the goals and the goal and or goals combination of is, then we have to stop and look at how we're going to approach this. And a lot of this has to do with what the client's adaptive ability is, their ability to respond to what we're doing. So if we're using a palliative approach, we're not asking for a lot of adaptation. We are applying a nice full body type of an approach to massage, but our intention for change is limited. If we're using a restorative approach, then what we're going to be thinking about is, how do I help the body recover from generalized life in general? Like we use that with the athletes. They go out, they practice, they got to get themselves back to where they need to be to practice again. We see that with somebody who has worked all day and then they want to get a good night's sleep and they want to come back to
Sometimes can be thought in terms of maintaining optimal comfort / capacity for activity. And in some settings, it's even perceived as prevention.
Yes.
Like prevention care.
Yes. And the palliative restorative approach, coupled with the idea of an outcome with relaxation and wellness, and then moving maybe even into stress management, that's the core of what we do. Mm-hmm. Then we have condition management. This is where people, our clients, have something going on. It's a chronic condition. It's something that there's not any likelihood that there's going to be huge shifts in their physiology. But interventions like massage can help them do better for a little while. So if somebody is complaining of something, like they have an arthritic knee, or they have chronic headaches, or they have fibromyalgia type syndrome, or persistent stress that results in anxiety, we're moving more into the condition management idea, and it's more than prevention. It's trying to smooth things out so the person can function as well as they can at any given time. Then finally, therapeutic change, which we don't do very much. People would like to think they do. This is where you're actually working to reverse.
Oftentimes, condition management is, well, I should say therapeutic change is miscategorized. The perception really is that most people, they're seeking that that therapeutic difference that helps them function more comfortably and better, but it's something that's either a repeated stress. So in sports, they're going to keep playing basketball.
That's right.
And the symptoms that occur either related to playing basketball or going to persist because they keep doing it. But true therapeutic change, maybe a better thought process with that is the recovery post-acute ankle sprain.
Yes.
Something like that. There we're actually helping facilitate some genuine full transition that does not, or at least hopefully, reoccur.
And a lot of people will say that they do medical massage or orthopedic massage or some of those kinds of ambiguous terms that have not been defined when they think they're doing therapeutic change, and they're really not.
And a good example of that might be somebody that has undergone joint replacement.
Yes.
Prior to joint replacement, dealing with the arthritic joint itself, we would be certainly in a condition management, pain management scenario. Post the actual replacement, we will be in a therapeutic change. But once they get to an optimal point at which they're functioning, there is still going to be an adaptive mechanism that translates through the whole body, and the new joint is going to be as good as it's going to be at a certain point. And so you're going to phase from therapeutic change to condition management again.
Yes, so. And that may be where you stay, is hovering between restorative and condition management.
Which is where you really want to be. Anyway.
Yes, it is. That's where our strength is at. Okay, now, those are our 4 outcomes and our 4 approaches to care. Now, there are 9 primary methods. Now, that's all there are. There are millions of names for these and combinations that are called modalities and all that. But if you really look at them, this is all there is. You can have just a holding, a static method. You can compress, push, down. You can glide, slide, stroke. You can twist, torsion, something, usually called kneading. You can move something back and forth. That's a shear.
Sometimes we hear the label more as a deep transverse friction.
Right.
Kind of more of a friction concept.
You can make something longer,
Yep.
elongation, not permanently longer usually, but you can take the ends of whatever it is and pull it apart as much as you can. You can oscillate something, shake it, rock it, vibrate it. You can percuss it, which is hit it, slap it, tap it, beat it, and you can move it around. And that could be either a joint or the tissue itself. And everything out there it can be classified with those 4 approaches. Now, what happens when you twist and press and glide and all that? Now we're getting into the effects. That it creates a mechanical force. And ultimately, that's a push or a pull, and that's it.
Yep. On some level, it can be a push and a pull at the same time.
Yep.
But ultimately, the forces that we use are pushes and pulls. Simple.
When you put apply a mechanical force to an object, if it can move, it will move. Like if you kick a ball.
Mm-hmm.
But if it can't move, then the object will distort or change shape. And so most of the methods we're using with massage are being done to change the shape of the tissue. And that then secondarily once that happens, the nervous system has to respond.
So with our mindful awareness of what our client's outcome is,
Yes.
we use these mechanical forces to get the tissue to respond via the nervous system so that we get, at least hopefully, and the optimal response.
Yeah.
And then, so how do we then modify these components to get those effects?
And that's where the 9 methods and the 2 things that happen with pushing and pulling with a force application become an infinite variation. So there are 12 modifiers. You can change the pressure from light to deep and everything in between. You can change where you apply the method. And you can apply it with a broad base contact or a narrow contact. We talked about that in one of our videos related to pressure. You can change the intensity. Do you go real slow with it and deep, or does it have a whole sense of pulley sensation to it? And people like intensity. So we got to figure out how to do that without actually harming the tissue. You change the direction. You go round and round and back and forth and up and down. Who knows, all of them together. The drag quality is that's often it's seen in what people want to call myofascial release, but it's taking that tissue and pulling it along with the method. And that is one of the big things that increases the perception of intensity.
And that is, the example of that is using more lotion.
Yes.
You will have less drag because you'll be slipping.
Yes.
Versus less lotion. If not no lotion, you will be gripping the skin in such a way that you'll be pulling the tissue along with the mechanical force that you're applying.
That's right.
So more drag essentially for us tends to mean less lotion.
And the person's going to feel like more is happening. Mm-hmm. And then we have speed, fast, slow, in between. Pacing. How long do we stay in one spot? How fast are our strokes? How often do we change direction with that? Kind of goes along with speed just a little bit. Rhythm.
So the 3 of those kind of sync together.
Yes, they do. And then we have the sequencing. So pacing and rhythm and sequencing. Sequencing is kind of how you get from one part of the body to the other.
Or sometimes call this flow.
Yeah.
It becomes the dance that we follow in order to cover all areas of the body in usually a time management oriented scenario. So.
And it's really important for each massage therapist to have a good sequence, just so that you have a pattern that you can follow that will relieve you from wondering, what am I going to do next? And you can get more into your critical thinking. Frequency is how many times you do something.
So is it 3 glides and 3 kneads and 3 compressions? Is it more or less?
That's exactly it. And how long you do it.
Mm-hmm. Is it an hour session, a 90-minute session?
And then also with the method.
How long?
Is it 1 second? Is it 3 minutes?
Mm-hmm.
And of course, the duration of application is going to also feed into the idea of magnitude or intensity. Now, we all frame this with, what are we trying to accomplish? That intention for application comes all the way back to, what are our outcomes? Where are we going with this? And how are we critically thinking to construct this massage and flavor it just right?
No mindless rubbing.
Perfect. Everything
should be focused towards the idea of the client's and the therapist's outcome for that session.
Finally, Luke, we get down to what the pushing and pulling of the mechanical force actually does to the tissues. The way that the tissues are deformed is called the stress. I know it's this is physics language. Engineers understand this. This is nothing new. But when you apply a mechanical force, you stress the object the force is applied to. So we're applying a mechanical force to the body,
creating a stress that creates then an effect.
Yes.
Now, too much, that's where it can be a case of too little, too much. Sometimes people will overwork an area with, maybe they're working too fast with too much intensity for too long a time, and that much stress might cause a bruise.
Yes.
Versus if it is slowed down and done maybe only a few times for a shorter duration, we get the optimal change in tone and the sense of something being well. So the idea is that a stress can be a good or a bad thing.
Or a bad thing. Excellent. Because these stresses, if they go beyond the adaptation, the adaptive ability of any particular tissue, then you get a breach. So that's how you sprain an ankle or break capillaries to the point where you get a bruise.
And that's a good example of whatever, in terms of injuries, to put this into context, a bruise is usually a compression-based injury.
Yep.
So you would not want to compress a bruise.
That's right.
And so a sprain or a strain may be a tension or a torsion stress, and we wouldn't want to stretch a sprain
or stretch or twist it either.
Or twist a sprain.
Yeah.
So, but we then also think, what do these stresses do to the tissue when we're trying to get it to change in optimal ways?
That's
right.
But
it's also beneficial for us to know what not to do for certain tissues, particularly when it's in an acute healing phase.
And understanding injury and understanding adaptive capacity and understanding the stages of injury repair will make a difference about our magnitude, our intensity, the modifiers to these resulting stresses. So these stresses are what happens to the tissue when we do stuff. Now, we want to make sure that we change it enough, create enough stress into the tissue so that the nervous system responds. And we get some mechanical force too. We get some pliability and that sort of thing. So we can press it. We can make it longer. That's the tension. And that's a stress. We can move it back and forth. That often will create a friction. We can twist it. That's a torsion stress. And we can bend it. So when we think about where we are going with the methods and the modifiers, we have to keep in mind this is what's happening to the tissues. And are we doing it in a way that's going to create the outcome that we want, and the client's going to get a benefit?
And that's where maintaining our intention is so important. And to be fair, more often than not, we're creating multiple stressors at the same time.
Absolutely.
I may be compressing the tissue while moving the adjacent joint back and forth, and that could be creating a friction under where I am compressing, as well as some, so that could be creating a shear and a tension force all at the same time. So we categorize this to make it all easier to understand, but we also have to be aware that it ends up souping together and becomes more of a little bit of a lot.
Yes.
But never too much of any one thing.
And when we apply the mechanical force to the object, which is our tissues with massage, that's called loading it. You load the tissue and you modify and manage that load. If it's too much load, the tissue won't be able to respond and you get your injuries. So we've got single loads, which is like pressing down on something, a compression. But more often we have what is called a combined loading, where, like you just explained, we have multiple stressors into the tissue. And we're hoping that the body understands the message we're delivering and we achieve more of a normalization. And every method that's out there, you can sequence out according to massage by the numbers.
Beautiful. So the next ones, we will be demonstrating this for you. So we'll see you on the next one.